How do I describe my child's symptoms to a doctor? When your child is feeling unwell, explaining their symptoms clearly can help the doctor understand what might be wrong. Start by giving your child's basic details like their name, age, and date of birth. If your child has any ongoing health issues or recent medical treatments, mention those too. This background helps the doctor see the bigger picture. Next, describe the main symptoms your child is experiencing. For example, if they have a cough, fever, rash, or trouble breathing, explain exactly what you see and hear. Tell the doctor when the symptoms began and if they have changed since then. Are they getting worse, better, or staying the same? Also, note how severe the symptoms are. Is your child mildly uncomfortable or in a lot of pain? Do the symptoms interfere with their daily activities or sleep? Be specific about the details. If your child has a fever, tell the doctor the highest temperature you recorded and how long the fever has lasted. If your child complains of pain, ask them to point to where it hurts and describe what it feels like, sharp, dull, or throbbing. Mention any other symptoms that come along, like vomiting, diarrhea, or difficulty breathing. Keep track of your child's eating and drinking habits, how many wet diapers they have if they are very young, and their bowel movements, as these can give clues about their health. If you have already given your child medication or tried home remedies, tell the doctor what you used, the doses, and how your child responded. Also, mention any allergies your child has to medicines or foods. Observe and report any behavioral changes too. Is your child more irritable, unusually sleepy, or hard to wake? Changes in mood or activity level are important to share. When describing what you see physically, include signs like skin color changes, pale, yellow, or blotchy skin, or breathing patterns such as rapid or labored breathing. For infants, note if they are not crying tears, have fewer wet diapers, or are feeding poorly. If your child can speak, encourage them to tell the doctor how they feel in their own words. Be honest and thorough when answering the doctor's questions. They might ask about when symptoms started, if they've gotten worse, or if your child has been exposed to sick people or traveled recently. It's helpful to write down your observations before the appointment so you don't forget anything. Focus on the most urgent symptoms first, especially if your child is having trouble breathing, has a high fever that won't go down, or is in severe pain. By providing a detailed, organized description of your child's symptoms, you help the doctor make a quick and accurate diagnosis. This is essential for getting your child the right treatment and care. Remember, always seek professional medical advice if you are worried about your child's health, especially if symptoms are severe, worsening, or last longer than a few days. Clear communication is key to helping your child recover quickly and safely.